I don't know about you, but when I learned about the death of Chadwick Boseman, I cried a little bit. Um, it's unbelievable. His death is devastating for so many different reasons. Of course, we know him from the Black Panther, but so many other movies. That movie for me was so like empowering and so amazing for endless reasons. And I know how I feel is multiplied by millions because I know everyone around the world is feeling the same. As you know, he has died at the age of 43 from colon cancer. According to reports, he was diagnosed in 2016. He's young. He was young when he was diagnosed. And according to other reports, he apparently was going through treatment for colon cancer when he was filming some of his movies, which is remarkable. So I always try to look at what we can learn from situations. And I wanted to talk today about the signs and symptoms of colon cancer. So here they go. I would say the first sign or symptom that you should be looking out for is a change in bowel habits. Now, you might be saying, what is that? Well, that can be maybe you had a certain type of bowel movement that happened every day, etc. And then now all of a sudden you are constipated more often than not. Or you have diarrhea and it's not typical or usual for you and it lasts more than a few days. Or maybe the caliber of your stool has changed. That's right, size and shape does matter when we're talking about stools. So let's say all of a sudden your stools become narrow or skinny, or they're a different shape, etc. That's something to take note of as well. And you've got to talk to your doctor if that occurs. Other potential signs and symptoms of colon cancer include bleeding, blood in your stool. That should always be evaluated, even if you think you know what the cause is. Even if you're like, oh, it's just my hemorrhoids. I don't care what you think it might be. And it might be that, right? But it needs to always be evaluated. But blood in stool can be a sign or symptom. Other things can be cramping or abdominal pain, sort of like abdominal cramping, abdominal pain, etc. Sometimes people do have abdominal symptoms like that. Other people may feel fatigued or have what we call unintentional weight loss. So when patients tell me that they've lost weight, one of my first questions is it intentional? Were you trying to lose weight, or have you been losing weight and you have not been trying? Any unintentional weight loss needs to be evaluated. Sometimes people with colon cancer have weakness or fatigue. They may also have anemia, which is a low blood count. And sometimes also people have a feeling that you need to have a bowel movement that really is not relieved by actually having that bowel movement. So, that's something to keep in mind as well, where you may feel like you have the need to have a bowel movement, but you don't feel relieved once you do so. I've had patients that feel fullness in their stomach. They feel kind of bloated. Honestly, there are many potential signs and symptoms of colon cancer. I think the most important thing is to know your body. And one thing I know is that you do know your body. We do. You've lived with yourself for all of your life. You know what's normal for you. And one thing I always say is if something doesn't seem right or something is different and you can't explain it, or goes on, continues on, you need to have it evaluated no matter what. Don't worry about bringing up symptoms and signs and things to us doctors and it being nothing. We hope it's all nothing. But if any of these symptoms happen to you or anything else that you're concerned about or worried about, please make sure you get checked for colon cancer and for any other things as well. Guys, I hope this is helpful. We are sending prayers to the family of Chadwick Boseman. May you rest in power. You did so much for so many people, inspiring so many of us, and the world will never forget. Guys, I hope this information is helpful. Please do share this video with others. Guys, I'm Dr. Jen Caudle. I'll see you soon.